Hi, I'm Dr. Nathan Wagner with Northwest Chiropractic and Rehab. And today what we're going to talk about is knee pain. Now keep in mind there's several different causes to knee pain, and you should always get a thorough evaluation before continuing to do anything that we recommend here or do anything on your own. Now, one of the biggest problems that people have, or biggest concerns I should say, that people have with knee pain is, should I stop working out, or should I stop doing any type of exercise or mobility and just let it rest? And that's probably one of the worst things that you do, and one of the biggest misconceptions a lot of people have. Because the more that we keep something immobile, the weaker that it's going to get, and the more stiffness and even more pain that's going to create. Now, I've actually shown that, with the latest literature, that moderate forms of exercise up to 5 times a week is enough to increase mobility, flexibility, as well as increasing strength. So we're going to go over some things that we're going to talk about that, because some of the key components to getting rid of knee pain is going to be increasing the mobility and the overall function. Now, one other big thing that I want to discuss is that, it doesn't necessarily have to be difficult or strenuous to become effective. So we're going to go over some 6 very easy to do things that you can do at home. You don't have to go to the gym to do any of these things that are going to help increase the mobility and flexibility, as well as strengthening some of the other areas of the surrounding structures of the knee. Now, one of the first things that we're going to do is we're going to talk about how easy it is to use a foam roller. Now, if you are having a significant amount of problems getting down on the ground to do this one, you can actually put this on a structure that has a nice surface to it, kind of like this table here, and you can do this right here. What we're first going to do is we're really just going to try to smash it and immobilize some of these tighter muscles here. Okay, when you start doing this, especially when you start focusing on muscles that you don't use quite often, like maybe on the inner sides of the legs or on the outsides there, they're going to feel a little bit tender or uncomfortable. Okay, all that's telling us is that we need to get those areas moving around more. Okay, so just kind of get going on through here, and one of the things I like to do is kind of create a number. Okay, maybe you're going to roll down the leg about 10 times. The reason I like doing that is because I can kind of see the light at the end of the tunnel there, and rather than maybe putting a clock on it and just trying to wait for that time to go by, because we tend to just kind of waste our time with that. So we're just going to go right up and down through there, maybe switch to the inside or to the outside there. Okay, and that's going to help kind of loosen up some of those adhesions that develop around some of those big muscles on the front parts of the leg. Now, the next thing we're going to do is we're going to go over some knee mobilization techniques during flexion. All you need with this is just a regular size bath towel, and what you're going to do is you're going to sit up nice and straight. Try to maintain a good curve in that low back. Don't let that thing collapse for reasons we've discussed in the past. But what you're going to do is you're going to take this knee, and I'm going to use this opposite one so you can see a little bit better what's going on. But you're going to take it from just a regular with a slight bend in the knee, and then you're going to bring that all the way to you. Okay? You're going to start by just doing 5 just easy pumps right through there. And then we're going to take that and hold right there. Now, if you're having a problem keeping your balance, you can lay all the way back and keep that nice curve right through there. Then do the same thing. Just 5 nice easy pumps. And then we'll take that to a hold. Try to hold that for about 15 to 30 seconds, and you can kind of build your way up. And while you're doing that, you can go just a little bit further until you start to feel that end range of motion. Okay? Now, with all of these exercises, even if your knee pain is primarily on your left knee, go ahead and do these on both knees. That way we're getting equal balance, so one side's not compensating more so for the other. Now, the next exercise that we're going to do is called a quadriceps contraction. Okay? Now, you have 4 large muscles along here that create the quadriceps, quad meaning 4. And what we're going to be focusing on is this big medial muscle right here. Okay, this one that's running along the inside of the knee and attaches right through there. So what all you're basically going to do with the quadriceps contraction, as the word indicates, we're going to cause that muscle to contract. Okay, so what we're going to do is we're going to try to straighten that knee out as much as we can, and imagine you're trying to push this towel straight into the table there. Okay, so you're going to push that down, you're going to give that a good 3 to 5 second hold, and then you're going to relax. And squeeze. Try to remember to keep that toe almost like it's trying to point back at you as well, and relax. I usually recommend doing about 2 to 3 sets of 10 of these, and do those at least twice throughout the day. That way you're strengthening those leg muscles throughout the day rather than just trying to get them all done at one time. Okay, so you'll again do those on both legs. Now again, we'll work those medial muscles of the leg. Now the next thing that we're going to do is we're going to do a little bit more advanced version to strengthen some of those same muscles. In order to do that, we're going to put something right underneath the leg. Again, you can sit up, or you can lay flat all the way on your back. And what you'll do is just kind of keep that leg hanging off the edge there. And what we're going to do is take that knee into full extension, and we're going to hold it there. Okay? Again, hold that for about 3 to 5 seconds, and then relax. We're going all the way up, and relax. Okay? That is actually just a quadriceps knee extension exercise. And then again, that's going to help strengthen that as well as engage some of these leg muscles in the upper portion of the leg. Okay, so the next thing that we're going to do is we're going to go over some supporting knee structures. Okay, we're going to do what we call a glute bridge. You'll probably remember as a kid, we used to try to do the bridge up. Well, this is going to be a modified version of that. And this is going to involve mostly the glutes and the hamstrings themselves. Okay, so what we're going to do is we're going to lay with both of our heels planted into the table, laying our back flat on the ground. What we're going to try to do is create a tabletop. So this is going to involve some core muscles as well as I said the glute muscles. Okay, those hips, those muscles that you're sitting on your bottom. So what you're going to do is you're going to get a nice good slow count. 1, 2. You're going to hold that for about a 3 count and relax. 1, 2. Okay, we're going to repeat that same thing. Go back up. 1, 2. Okay, we don't want to overextend because then we start activating some of those muscles in the lower back. We want to keep that just nice and stable, almost like if you're able to sit something right on the top there. Okay, and relax. Now this is going to help with as the hamstrings and the glutes are supporting structures of the knee. We want to make sure that we're keeping those strong as well. We also talked a little bit about things that we could do to help increase the mobility. So we're going to talk a little bit about things we can do to increasing the mobility and the flexibility of the hamstrings. Those are those big muscles along the back side of the leg. Okay. Remember I touched on how it doesn't have to be strenuous to achieve a good effect. So what you can do with this one is you can do this one sitting, and you want to try to keep that leg straight, but not all the way straight, and you have a slight bend in it. We're going to have the toe kind of reaching up off the ground, and what you're going to do is you're just going to flex forward, keeping that low back nice and straight. So we don't want to arch over because that kind of takes the effect out of the hamstring. So just trying to bend forward at the waist and hold that. I'm going to hold that for about 15. Try to build your way up to about 30 seconds there. Okay, do that about 2 reps of those on each leg. If you can get to, or you're not feeling a good amount of stretch right through there, you can do that same thing, kind of stagger your feet a little bit, and then just bending forward at the waist, and flex down and try to touch the tips of your toes if you can. Okay, so I like to recommend that one versus where we're actually sitting right here, because a lot of time, in order, because we don't have a whole lot of flexibilities in the legs, we tend to fold that back up. So I usually tend to do that one that's kind of that stiff leg stiff legs standing up. Now, the last thing that we're going to go over are the supporting muscles along the inside of the legs. Those are your adductors. Okay, they help bring that leg through when we're bringing it back during our normal gait. So what we're going to do is just going to do a nice little side straddle, and once you start feeling that pull in that inside of that leg, that's really all you need to do to get any type of real effect out of that. So we're going to step to this side, kind of like what we were doing with the hamstring stretch. It's just when we start to feel that, we're going to hold that for about a 15 to 30 second count. And then you can relax, you can kind of stand up and shake it out. And do another 30 second stretch right through there. And then work on that other leg. So those are 6 very easy things you can do to help increase that mobility, increase that function. So try those out, see how you're doing, and test and retest by doing different activities that was bothering your knee, whether it be walking, squatting, or jogging. And then we'll be talking with you next time. Thank you.